Okay, so this unit is called Viva MD, and it offers two effective treatments that target skin damage and reduce wrinkles. Like for instance, like you have some scars on cheek, and that's what we're going to target today. So the first modality is called nanofractional technology, and it delivers precise energy to the skin. The energy gently heats and illuminates damaged tissue, prompting the skin's natural healing response. And this process stimulates fibroblasts. It activates the production of new collagen, resulting in diminished skin damage, visibly firmer, more even complexion. And that's the idea for today.
Okay, let's take a look at my face. I have some, oh my God, my face looks so bad in this light. But it is what it is.
Okay, why don't we show what we're targeting today? We're targeting the scars that you acquired. What was the scars from?
From electrolysis.
Ah, wow, electrolysis related scars. So we're going to try and fix it. So you cooked yourself?
Not myself, somebody else. And on the other side, the same. And redness, some redness.
Yes, we're going to target a little bit of redness and mostly scars. So this particular treatment is aiming to resurface the skin. I'm ready.
Okay, so
in order for me to start using the machine, these are the individual needles. They're not needles, they're pins, and energy is going to travel through those pins. They're sterile and they're individual. So I opened up the box, and here it is. Oops. These are the pins that we're going to be using. They're 160, and I'm inserting them. I'm ready to go. Make sure to be sterile.
okay.
I could go right above the cheekbone, providing that I'm still on the orbital rim, not on the soft tissue.
What about the neck? Do you usually go
I can
on
do
the neck?
I can do the neck. The only thing is that the recovery for the neck is a little bit longer than for the face. We can do the neck maybe when you have a little more time off.
Usual recovery is what for average person? Because we did
average person on the face is going to be a day, 2 days max. Like for some people whose skin I've already treated, recovery for like 24, 48 hours. For the neck, it's going to be a lot longer because the skin of the neck and décolleté is much thinner. The thinner the skin, the more recovery. So you will see the grid marks for a bit longer, but other than that, it recovers. Right after a treatment, we're going to add the exosomes. These exosomes are drawn from bovine colostrum, and the idea of this exosomes is to achieve natural brightening and rejuvenate the skin. This treatment is usually recommended for hyperpigmentation, dull skin, scarring, acne, rosacea, other skin conditions, like for instance dermatitis. Even after dermatitis, people who are treated post-dermatitis, we can apply exosome immediately after a treatment. And we can also use it after laser resurfacing, RF microneedling, any light-based therapies. These exosomes have 20 billion exosomes, 20 functional growth factors, plant-derived seed stem cells, antioxidants, and peptides. And all of these ingredients mixed together are in the vial. So basically, I just take it out of the box, open up the vial, and draw exosomes. And have it ready. So as soon as I treat one side, I apply exosomes and then move on to the other side.
It's like gel texture.
It is quite jelly. So wipe it one more time so we know it's all sterile. I'm usually sanitize the face with chlorhexidine because the procedure is sterile. The needles that we're using are sterile as well. Okay, so we can start the treatment. One, two, three. What does it feel like?
It feels like needles, but not painful. Very tolerable.
It's very quick.
Yeah, very quick. And doesn't feel like it's deep. And it smells a bit burnt.
Right, because it burns the superficial layer. So I'm overlapping about 30% to make sure that I'm covering the entire area. Just face me. You okay?
Yeah.
Tell me if you want
This
me to
part
go
is a
slower.
little bit more sensitive, but still very tolerable. No, I'm okay.
I'm gonna fill in the blanks as I go along. So I'm not treating the lip, but I'm treating immediately after. 1, 2, 3. This area is right on the bone, so it might feel a little more sensitive.
It felt a bit more sensitive, and you feel almost like a little vibration here. It's interesting. But I don't feel the heat per se. I feel it now, like a little tingling sensation.
I know, you faced me.
Sorry.
There you go. And I'm gonna treat the mid face. Ta-da!
Quick question. You can't treat the mole, correct?
Going
You're
over
not
the-
go
no.
over the mole.
No.
And also the nose. Can you treat the
I can
nose?
treat the nose.
Yeah.
Good, definitely. Okay, so
You want me to stretch?
Excellent. Yeah. 1, 2, 3. This area is just a little bit more sensitive, so I'm gonna count for you, and I'm gonna waltz around them all. There you go. Okay, stretch the lip again. I'm gonna go over the lip. 1, 2, 3. Okay, let me
You
go
can
to
see
the
the
other
redness
side.
now. This is the closest you can go to the eye.
I could go a little higher. I could still stay on the orbital rim. As long as I'm on the orbital rim, I'm safe.
You can see the erythema
And I can pull
now.
the skin down.
Yeah, let's do that.
Okay. Let me just pop. Oh yeah, you have plenty of room.
Ooh.
I can go higher, a little higher. Okay, 1 second. I can still treat you here. Let me just palpate where I am. There you go. That's the area where the scar is. Question?
No, it's okay.
You're good? Okay, I'm gonna start from the temple and go down. If you have the camera a little closer, you will see the grid. See? Okay. for the eye.
Oh, this
Sensitive.
one. Could you use numbing cream here or no?
Yes, I can. Do you feel like you would want one?
No, I'm okay. But usually people want some numbing cream.
If I go more aggressive, yes, I could numb. Since we're doing it for the first time, I'm also doing half a grid. So it's less aggressive. This area is usually where the nerve ending is a little more sensitive. The mental nerve. That's why maybe you feel a little bit of trembling. Okay, and bite the lower lip so I could get, just a little looser, just a little bit, relax a bit. 1, 2, 3. Unpleasant. Okay.
This is actually okay. For me, the most sensitive was here, closer to the eye. You can see the redness now. Now I feel like good sunburn.
Yes, that's what it is. I like to apply the exosomes because the holes are still open. So the area has been cleaned previously.
Oh, it feels good. It feels cold.
That's why I kept it in the fridge. So never mind, it's delivering the 20 billion exosomes and growth factors and peptides. It's also cooling off the skin. It makes you feel just a little bit more relaxed. So this particular one is for the skin glowing, for hyperpigmentation, for rosacea. That's the purpose of today's treatment, right? To tighten the pores so your pores are a little bit smaller, the rosacea looks a little softer, and obviously the scar.
You would also use it the exact same way after microneedling, correct?
Exactly, exactly. But while you're doing microneedling, you could microneedle on it. But with radiofrequency, I deliver the energy first, and then I apply exosomes.
Yeah, because it's a good gliding agent too.
Exactly.
It's a gel.
Yeah. Let me wipe the nose one more time. I'm a little cautious. Got a little bit of exosomes here. Let me wipe them. Okay, I'm gonna start from the top and I'm gonna go all the way down. So this might be a little more sensitive just because it's a forehead. There's not much fat there. And the fat pads are thinning out. So
I don't feel this one at all.
no, okay, great.
It's really...
It's great. It softens up the wrinkles. very nice and red. Let me do the glabella area. You also have another scar over here.
Yeah, I have a scar because I had a rhinoplasty, and then I had a necrosis.
Okay.
And this scar has actually been filled with a filler a couple of times, and filler did a good job, and it never dissolved here. But the tiny bit of a scar is still left, not as severe.
So let's see, maybe we could soften the scar as well. It would be interesting to see how the pores on your nose will shrink.
Let's see. I'll film tomorrow what I look like. 24 hours and 48 hours.
1, 2, 3.
And we'll see. What are the contraindications to the procedure? You said you mentioned metal implants.
Metal implants, yes.
I'm guessing eczema, psoriasis, any types of skin conditions?
Any active skin condition is a contraindication until the healing happens, right?
Mm-hmm.
Other than that, there are not that many metal implants.
Anywhere in the body, like a hip replacement?
No, hip replacement is not a problem on the face, on the treated area.
Yeah. Okay.
And of course, cardiac ones, right? Like if there is a stand, then I wouldn't treat the patient.
Beautiful. I look already 10 years younger.
You see, the skin is already less red. Initially, it was much more red. It has been done. But if we did not have exosomes on, then I could have filled maybe tiny little gaps.
So if we didn't do exosomes, what would you do after the treatment other than this?
Oh, like I would have done NCTF. NCTF is also a good idea.
Like hyaluronic acid and vitamins, some other not as expensive.
Although it's off-label at the moment, the ideal treatment is the treatment all by itself without any additional exosomes, NCTF, vitamins, minerals. It doesn't matter. But the idea of me applying exosome is just taking advantage of the tiny little micro holes that's been already done. Even though radiofrequency already delivered the radiofrequency pulse in there, we could still top up with exosomes and take advantage of it.
Okay. One more question. Aftercare, sunscreen, I'm guessing?
Okay, so for the first 24 hours, we're not applying anything at all. You're keeping the face dry. The only thing that you can do, you can take antihistamine if you feel exceptionally hot or exceptionally red. Other than that, there is absolutely no you're not applying absolutely anything.
24 hours.
24 hours. 24 hours later, we're going to switch to regular care. You're going to wash the face with a cleanser. Preferably it's a mild cleanser. My favorite one is Epicuris. That's from the same family that I'm using the exosomes from. Also, then you're going to go with a serum as a treatment and provide hydration with Hubia cream. All of these ingredients have been researched by professionals from the Princeton University. I've seen the results. They also help with the redness dramatically. It subsides redness much sooner than if you were to use any other cream. But if you're not using anything at all, it's still gonna go down without any help.
Okay, perfect. Thank you. Here is an update. It's been 2 hours since the procedure. As you can see, redness subsided. It's significantly less. You can still see some here, but less here. And I still have leftover gel. It's like a clear, thin layer of gel still left on the surface of the skin. This is not skin. This is exosomes still. Here is 24-hour update post-procedure. As you can see, redness subsided. There is pretty much no redness left. I wanted to say that burning sensation went away a couple of hours after the procedure. Now the skin feels dry, like after the sunburn, like a mild sunburn kind of dry. Other than that, all good. As you can see, pretty much healed. Here is 1 week update post-treatment. Dryness was gone around after 3-4 days, I would say. I really liked, I think I see a good improvement in my capillaries, in my redness. This is the same light in the treatment room. The skin is glowier now. What do you think, Mariana?
I agree.
Mm-hmm.
Much glower.
How many treatments do you recommend? I forgot to ask.
It's recommended like 3 treatments, about 2 months apart.
2 months apart, yeah. So we only did one. It's July. I'll try to do more, hopefully, and upload more results.